Hello, my name is Alex Hughes. I'm the lead nurse practitioner here at Austin Urology Institute. This is your hydrocelectomy pre and post-op video. So hydrocelectomy, so a hydrocele, that's what the diagnosis that you have. So you have your testicle here, right? And your testicle has its vas deferens. There's another sac, not your scrotum, but a sac that's a temperature regulator of the testicle. So think of it, you got your scrotum here, and then you have this little sac around the testicle. That little sac can fill with fluid. And that's what a hydrocele is. And that hydrocele can start to put pressure on the testicle, and it can mess with fertility. Cosmetically, it can be annoying. So sometimes my patients will be like, I can't go to the gym because these things can get, as big as, a cantaloupe or a watermelon. They can be as small as a softball. So a hydrocelectomy will open up the scrotum. So you'll have external sutures. So when you wake up and you notice a suture line on your scrotum, that's how we have to get to the actual hydrocele. And then what we do is we actually cut open the hydrocele and we turn it inside out, and then we suture it along the actual other side of the testicle, because now the fluid can leak into the scrotum and then get reabsorbed by the body. One thing that you may or may not have, our doctors make a game time decision on this, is a JP drain. So you may wake up and you have a drain coming out of your testicle that's hooked to like a little grenade. That will slough off any kind of blood that's kind of accumulating in the actual surgical area. And that if you do have a drain, that'll be removed in the office probably about a week after the procedure. So one thing that I do tell my patients is the testicle will feel different. Now, it's not actually the testicle, it's the sac outside of the testicle that feels different. But when you do your self-exams, like after you've all healed up, it may feel a little bit lumpy, and that's where the suture line is. Biggest things to watch out for are hematoma and infection. So hematoma is a blood collection, so that's why we do these drains. But sometimes they can form even after the drain is pulled. So if you have acute swelling around the testicle, that could be a hematoma. It needs to be seen by us, or you could have a testicular infection. All of those things need to be reported to us. Monitor for fevers, and then no lakes, no pools, no submersion of the testicle, so no baths until that external suture line heals up. So that's your cue to get into the water, and no sex or masturbation for about 2 weeks until you're completely healed.